All right. Hi everyone again. Welcome to SoftFil Academy's live masterclass. This webinar was organized in partnership with our Lebanese distributor, BioPharm. So welcome to all the Lebanese doctors, doctors from all around the world. Don't hesitate to let us know where you come from in the chat. We love to know where everyone is from. Welcome to Dr. Lanfranchi and Dr. Sebban. Thank you for teaching tonight. I'm gonna start by speaking a bit about SoftFil and our products, and then I'll introduce a bit more our speakers. Okay. So SoftFil is an international brand with customers in more than 90 countries. Its mission is to develop a range of reliable and safe tools for aesthetic practitioners. So SoftFil has, of course, a range of micro-cannulas. SoftFil also developed the Easy Guide, that is an insertion needle that was patented. We also have 4 cosmetic products and the SoftFil Academy to teach about micro-cannula injections. A little bit more about our range of products. So the SoftFil Precision range is the largest and most advanced range of micro-cannula on the market. We have the range going from 30 gauge to 22 gauge, that is for face injection. And recently we developed a range for body injection from 20 to 14 gauge. So overall, we have 22 size of micro-cannulas. We also developed the SoftFil Easy Guide, that is a universal insertion needle for easier injection. You will see our experts use it tonight, so you can see how to use it. It's obviously very easy, and we have it in 6 sizes. Now a little bit about Topilaz. That is a very new product for us. We just launched it. It is a topical hyaluronidase made of 100% of natural origin ingredients, and it allows the skin to recover the ideal hyaluronic acid level of the skin. So Topilaz models and unifies the surface of the skin. It adjusts the volume of HA to restore the skin's natural appearance. It smoothes surface irregularity and reduces defects. Now a little bit about Dr. Lanfranchi, who is an Italo-Argentinian board-certified plastic surgeon who worked in South America and Europe, and is the founder of the plastic surgery and medicine in Milano and Dubai. Oh. He's a member of the American and European Plastic Surgery Association, and he has extensive experience in cosmetic, reconstructive, and aesthetic medicine. He's a key opinion leader, lecturer, and trainer in plastic and cosmetic procedures, and he has published a number of scientific international journals and magazines. Dr. Sandrine Sebban is an aesthetic physician from France. She has 20 years of professional experience in the broad spectrum of aesthetics. She's the inventor of several injection techniques, cannula injection techniques, the soft filling technique, the one-point technique, and the stop facial aging method. She's also the inventor of the pilot needle SoftFil Easy Guide, and of our new, more recent product that I just introduced, Topilaz. She's a global KOL, a trainer, and an international speaker. So thank you for being here tonight. You are tonight going to speak about which cannula to use for which zone. So we will talk about the entire face today, upper face, lower face. But first I wanted to say that this visual, all the participants to the webinar tonight will receive it via email tomorrow to have a bit of a reminder of where to ideally use each of our cannulas. Dr. Lanfranchi, you are first. I let you take the floor. Maybe you want to share your screen now.
Excellent.
Great. Okay, now you can go ahead and share your screen.
Okay. This one. Okay. So, can you hear me?
Yes, very well.
Excellent. So, good afternoon, good morning, good night, good evening, whatever. It's really an honor for me to be here with you today. Long time that I've been using, of course, cannulas. As I like to say to myself, I define myself like something like a cannulist because I really like them. I use them a lot. I will share my experience, my everyday, what I do every day with this large variety of products that we have. I'm a board certified plastic surgeon, as Hannah already introduced me, so no more words. Of course, I'm a plastic surgeon and I love to do surgical procedures. The trend in the last 15, 20 years is always less invasive procedures. And that's because of the improval of devices, materials, and technologies and techniques. Why not? That's why we are here to share our experience and to learn from each other. It is true, of course, that there are differences between surgical and medical procedures, but there are lots of things that can be reproduced in a non-surgical way that generally we do surgically. And that's particularly for those who are surgeons, we obtain for sure better results, but above all, we enjoy better our work, no? So we know what happens with the passing of the time. We keep on talking about that, skin laxity, volume loss, which is very important and common, and this is something that we can, with fillers, we can give and restore. And of course, the aging phase, with the passing of time, we tend to lose volume, together with losing skin, soft tissue, together with soft tissue ptosis. So this is something we can restore. With fillers, we can lift, and we can, of course, restore volumes, which is very important. For the mid phase, things that we know, and I will talk to you once I divide the face little by little, from the temples to the nose. So the power of fillers, of course, pure cosmetics, we can treat asymmetries, and we can also treat scars, as I will show you. Of course, the best result is when you use, of course, less product for you and for your patient. That's at least my philosophy, and this is the latest trend for sure. With the cannula, we can dose it better, which is something I will show you, no? When you use it. So it's very important and gives you also that. With an increase in the recent years of injectables, of course, hyaluronic acid embolism increased too, leading to serious complications, including, as we know, unfortunately, blindness, movement disorders, skin necrosis, and cerebral embolism, which have been described. So we have to be very, very careful. And of course, we need to respect anatomy. And well, this is the part of our training. No? Of course, we study, then we practice, and we keep on improving with techniques and materials, for sure. So we know the connection between external and internal carotid system, and this is why we can have bigger trouble if unfortunately we have an embolism. So this is what we want to avoid, and this is unfortunately what I've seen. This is a case that this woman believed that the cause of this black areas, she defined it, was the ice that my colleague put her after, but you know it is not that way. So fortunately I could reconstruct her, but this is something we don't want to see, and this is something we want to avoid, and this is something we have to be very, very careful. Of course, with fillers we can treat different anatomic reasons, and with different possible injections techniques. You choose the one you like more. Personally, with cannulas, I feel better, I can dominate it better, I can place better my product, and I respect better, of course, the anatomy. Why? Because we inject practically everywhere, and as soon as we keep on improving, we can inject everything. If I think what we used to inject 15 years ago is not the same that we inject today, for sure. So, but we have to be very, very careful, because we have to respect the anatomy and we don't have to create embolism or something like that. So highest risk of injection site responsible for ocular complications are glabella, nasal, nose region, nasolabial folds, and foreheads. This is the main classification. Of course, this is an excellent book from 1936, which is it's French, Les artères de la peau, arteries of the skin, and this is something we need to avoid. So whatever we inject, we have at least some risk of getting one of these. So we have to be very careful. Of course, retrograde, this is what we want to avoid. So we start by the glabellar area, in which we have the supratrochlear and supraorbital arteries, from the internal carotid acid via the ophthalmic artery. So we have to be very careful in this area, okay? We have to, particularly if you are injecting the forehead of the upper eyelid, you have to be very, very careful with that. When we inject the temple, also in this area, we find of course, we use them for temporal hollowing. We have the frontal branch of the superficial temporal artery and, and the middle temporal vein. After crossing the temporal crest, the artery changes plane, so we can find it in the subcutaneous for the forehead. So it could connect with branches of the supraorbital artery. So that means that we can have ocular trouble if we get inside one of these. So we have to be very, very careful. Of course, we can also inject between the two fascias, that is between the superficial and the deep one, as I will show you. And also in this case, we have to respect the superficial temporal artery. Okay, so also with the cannula, for me, is safer. The nose is another complete chapter, because I think it's the most complicated and which we have higher risk of having not only cutaneous necrosis, but also we have retrograde embolism. Of course, we have a connection between internal and external carotid arteries also there. I will show you better in my other pictures. The thing we use most is when we open the nasolabial angle is the columeral artery. We have to be very careful with her. That's why I will show you the technique, how I do it with the cannula. Personally, I prefer always cannula, to be very honest. But in the temple, when I do the deep plane, in those cases when we have a very severe concavity or temporal hollow, in that case I will do the gunshot straight on with the needle, as I will show you. It's like a journey, a cannula journey, as I call it. The indication, the anatomy, of course, are mandatory, using the right product, okay, with the right technique, of course, to obtain better, safer, and long-lasting results. The power of the cannula, why? Because I think is when the detail makes the difference. Why? Because you can play with the flexibility of the cannula, as I show you here. You see, with one entry point, what we see, we play with the flexibility. We can reach practically every part. Of course, you need training. There's a learning curve. But you can reach everything with less, pricking your patient less, which is something that I really like. Of course, if you use your non-dominant hand, you feel it and you guide it wherever you want, as I will show you with some cases that I prepared for you. Also, it's very important to know where this red dot is, because we know where we'll inject. And particularly, it helps me a lot when I'm treating the nose, where really a small quantity and the detail will make for sure the difference, particularly when we are treating asymmetries or post or second or after secondary rhinoplasties. But you see, you turn you know very well turning your cannula, and you know where to place your product. And this is something that for me in the nose makes the difference. So cannula, yes or no? Well, this was a test I did a couple of years ago in which I had, this is the frontal branch of the temporalis superficiale, and I tried to prick it with the 27 needle, cannula, as you see there, and it's really difficult. You need really to go straight on to prick it and to get inside. But we have to be very careful as usual. We're talking about the temple hollow. Well, you can, as I said before, depending on the depression, you can use it. You can go straight on down to the bone with a gunshot if I need those cases. HIV patients, I use that. Okay, it's very frequent for me. I go deeper pre-periosteal with a gunshot. In that case, I will use the 27 needle. But then the most important one where we can have the difference is when I treat the subcutaneous area or subfacial, which is something between the superficial and deep temporal fascia, which is something that I don't use that much. I prefer the subcutaneous area, okay, because I can mask if I have vessels that's I can see the vessel, the patient sees the vessel, so this will smooth it. I can blend my product, etc. So in that case, I will use the upper to mask veins, the rust and irregularities. You must use the right product, but a product that is easy to shape, but with the right technique. In this case, of course, I will use the 23 gauge cannula to treat all the area and to make it smooth. So this is a common case in which I use, as you've seen before, and I treated the temporal area with the cannula, 23G. A cannula journey. I've chosen this case to show you because it's a patient in which she came just for the lips, was her first approach. My friend and colleague Sandrine will talk about lips, so I won't talk about that. But she came for that, and it was like a journey with her, because as you will see, I not only treated her lips, but I treated also other areas, as I will show you. After having treated her lips, she sent me a picture like this, and I'm so happy, look at my lips, etc., etc. And she was, like you see here, of course, she had a nice makeup with highlighting her middle third, her zygomatic hair. And I said, I can obtain that when you come here. And this is what we did. This is what I did, you see? So in this case, I'm just drawing the area I want to highlight. And with, as I will show you, with one entry point, as you see here, you can dominate the whole middle third. This is what I prefer. You go there, playing with the flexibility as I showed you before. And in this case, you can use as you please, 22, 23 gauge, or even 25, 5 centimeters long. That you can reach every area. You can reach every fat pad without any problem. As you see here, in this case, I was just pre-periosteal in the lateral part, okay, zygomatic area, because I just wanted to highlight that area, to repeat that makeup concept or effect. And this is what I did. Straight on, pre-periosteal, I feel where I am with my cannula, okay? The 25 gauge is an excellent cannula. I like it. It's too flexible, so you have to feel it very well. If not in doubt, you use 22 or 23, which are better, particularly if you are starting to use cannulas. Of course, as you see, my dot is towards the bone, to the deep part, and I just put it 0.2 each side. Very little, because I know where I am. I will dose it, and it will stay there. And this is, as you see here, treated and untreated, an untreated area, okay? And you will see it better in the other, in the other slides I will show you later on. Very important when we treat the periorbital area it is the topilas, because all of us have seen these kind of patients. Hopefully that they are not yours, because I'm sure you those very well this, but you can see this, let's say, late edema, and which can be treated with the topilas that Sandrine will talk you and Hannah introduced to you. This is an amazing product because you, as we discussed with Sandrine and all the team, you correct, as you see there, the pictures talk themselves, but also for those patients who feel the filler, okay? I said, doctor, I feel it. With this, you reduce also the perception of the filler in certain kind of patients. But my colleague will talk to you later about that, and he will explain better this. But as you see, the perioral area is amazing because it's thin skin, it will penetrate immediately, and you will see immediately the result. As I said before, in this patient, it was like a trip, a journey, because I also treated, as you see here, her nose. Having a 5 centimeter cannula, you can reach everything. You see here, I'm flexing, playing with the flexibility of my cannula to see where I am. I am in front of the nasal spine. So I get also to the fornix if I want. So doing like this, I open the nasolabial angle, I reinforce the columella, and I also block the downtraction of the depressor septi and myrtiform using only one entry point. Then I can flip over and go to the proximal part, as I will show you with other cases. Too many things to say, but I will say them. I will tell them all. As you see, having treated leaves, perioral area, middle third, and also nose, this is what we want, happy patients for sure. And this is what we want to avoid. So this was a case, is the same patient, as I showed before, and we have to be very careful if you inject directly straight on with your needle, which is something that if you want, you can do. But this is a case that I've seen, it came to my attention because my colleague just goes straight on. He aspirated with a 27G needle in the nasal spine, so what should be so safe, but she found out this sufferance of the septum. So we have to be very careful. And for that, I will show you the same patient after 1 year, okay? And I will show you that I used the 23 gauge cannula.
Yes, 26.
Sorry, 26. Sorry, Sandrine. 26 cannula, a short one. You see, I'm there just to show you that I can feel where the nasal spine is. You feel it. You feel the difference between the nasal spine and the cartilage. And once you're in, you go straight on and you lift it up just as a touch up. Why? Because as we know, our fillers will stay longer in the nose rather than in other areas. Okay, so in this case, it's my touch up after 1 year, the same patient with this excellent cannula. When we are treating, for example, the tear trough, well, that's something I use. I mean, I've always used cannulas for sure. We see where it is, we see what we want to treat. Of course, we find and we use the right product. And this is the main technique. I will go straight on because we don't have too much time. You see, in this case, where it 25 goes 40 millimeters, I go with the easy guide straight on. It's so easy to get in, pluck, and then you feel it. I'm submuscular. I go there, I feel the tip of my cannula, and I place it. Okay? You can use the 22, you can use the 23, as you please, as you like. So you feel it, you play with the flexibility of the cannula, and you feel where you are. You feel it, and you can obtain results like this. Okay, when we feel it, and that's it. Very precise, small quantities. If you need, you can retouch up, no worries. We can treat scars, and when we treat scars, this is a dog bite, okay? When we treat scars, we need the cannula because we need to undermine the area. We need to release our scars. And this is something that I use. If we play with the power of hyaluronic acid to increase and to improve the skin quality, this is the effect after 2 years. So it keeps. Is for sure I've detached it, I treat it, but then I put also a little bit a tip of hyaluronic acid, and you see there. With one entry point, we dominate the whole nose. We play with the flexibility, as I said before. You see, we can go there. You dominate all. And when the tip and when the product makes a difference, you know where you place it. You see, in this case, I want to show I want to sculpt the nose tip. So I need my product to be there. I want to see it where it stays. So I flip over the little red tip and I want to be as superficial as possible with one entry point for sure, where you make the difference. I use the cannulas to undermine, particularly if in secondary rhinoplasties, but you can place, you see, this is a complicated case. You see, I just feel there very asymmetric. So with the cannula, I detach and then I inject, and this is very safe for me. You see there, we can, as I said before, we can reinforce the nose tip, we can project, we can open the nasolabial angle, as you see there, always feeling the tip of the cannula. You feel it, and we reinforce, we detach, we undermine, etc. And we dominate, we lift, and we give tip definition. Also, in this case, you see a little depression there after a rhinoplasty. I treated it by first undermining the area and then putting my hyaluronic acid. Remember, and after rhinoplasty, you have to be careful about scars, retractions, amount of hyaluronic acid, and cannula dissection, which is, for me, a must and is mandatory. To treat cases like this, asymmetries, where you must dominate, but you can place your product where you want. And safety first, as we say, this is mandatory for everybody. That's why we are here also. And this is one of the, I think, of our masks where I feel safe, and I will keep on using them, because remember, it's not, nothing in medicine, at least for me, is easy. Okay, nothing for me is easy. And I think that when you think something is easy, it could be really a big headache. So we try to simplify out our techniques to be more precise, faster, less invasive, better materials, and our main aims, safety. And cannulas, for me, are safe, and they represent one of these tips I wrote to you there. Thank you so much, or grazie or merci, or obrigado, or muchas gracias, or whatever. Thank you so much for your attention, and I give the word to my friend Sandrine Sebban.
Thank you, Luciano. Thank you very much. It's very interesting to see how we can use cannulas everywhere and with the most safely that we can. Anna, you will probably show us my presentation. I want to begin to present you, cannulas from SoftFil company. And of course, after I will continue the presentation with the lower face. So at first, you know that when we are, I work with the hyaluronic acid since more than 20 years. And now we know that we change our, trends. And we are now, of course, restoring the volume everywhere. We have, a concept with the global treatment. And why? Because tools are evolving. And of course, industry is evolving too. And we have different texture of HA, different, cross-linking of different companies. And all these different cross-linked HA are adapted for different plan, different level of the face. Of course, the tools that we are speaking about, the cannulas, are very interesting for 3D volumetry, because now with safety, we can consider the restoration of volume in the bone level, on the bone level, into the fat, the deep fat, the superficial fat, and of course, we can treat the subcutaneous level of fat and the skin texture, and everything could be done with cannulas. Of course, with needle too, but cannulas are very, secure, and it's very interesting to treat like that. So, as you see on this slide, we have now the possibility to inject with most safety. We did this dissection with Luciano together, because Luciano, you have to know that it's my friend. And I tried to go through the superficial, branch, the anterior branch of the temporal superficial artery. And it was very hard with the cannula, but Luciano came with his needle, and it was easy to cross the artery. So, of course, you know that cannulas are safer. We have this notion before, but now it's proved in this, publication in the JAMA Dermatology, was published in 2020. And now we know that it's 5 times less important to have, vascular occlusion with the cannula than with a needle. So this publication was done with 370 doctors. They used 1,700,000 syringes, and it was proved that the vascular occlusion is 5 times less important with cannulas. So next slide, please. You know that the cannula of SoftFil is, of course, very interesting, because there is different landmarks on. There is a graduation every centimeter. We have, rigidity and flexibility. We have the best balance between together. And I would like to show you something. You see, with the 25 gauge cannula, you see the embasis, of course, orange. This is 25. We have 3 different sizes. We have the 4 centimeter, 5 centimeter, and 6 centimeter. And sometimes some doctors are telling me that it's the SoftFil are flexible, more flexible or more rigid, but you have to consider the length of the cannula. If you use, of course, short cannula, you will have more rigidity. If you use a long cannula, you will have more flexibility. But if you use the 25 gauge and 5 centimeter, you will have the best balance between rigidity and flexibility. And it will be exactly the same with different lengths, different caliber. You can see here the 22, the 23, or why not the 25, of course, I showed you before. And you have to know that the trend is moving to larger cannulas. At the beginning in 2008, when we launched the cannula technique, a lot of doctors were using the 27 gauge for lips, for example. And now we are changing a little bit our use, and we go to a larger caliber. For lips, we use a 25, and it's all over the world like that. And some doctors are using the 22 gauge into the lips. I think it's a little bit too much, but why not, to be safer. So you see quickly the embasis of the cannula. It's Luer-Lock basis, and you can see the red point on the embasis in order to show you where the product go out, because you know that the hole on a cannula is lateral, the opposite of a needle where the hole is in the center. So you see here precisely how is the tip of the cannula, and you see that the hole is lateral, and you see that in the SoftFil company cannulas, the tip is very round, and it's to be safer. So this round tip that you see here is the safest of the market. So now we'll stop just a minute the movie in order to show you, something into, the patient. So it's very important to have a notion of anatomy, you know that. Of course, we have arteries and veins under the skin, as you know. And of course, you know that the most important is to avoid to cross the main vessel, who is the facial vein and the facial artery. So if we have a look on the face, we can see that the facial artery here is going into, along the nasolabial fold, but in the external area, you see here. You can see that the labial artery, superior labial artery and inferior labial artery are beginning, 2 centimeters from the commissure of the lips here, as you can see. And of course, they are going along the lips and the mucosa. So it's very important when we are injecting, and a new publication show us that it's better to inject with cannulas, and it's better to inject, superficially into the mucosa, and not in the wet and dry border into the lips, because we can cross a vessel. And of course, if we are going into the direction of the lips, we can have a big problem with the needle. So if you inject with a needle, you have to go perpendicularly to the artery and very superficially, but not, deep in this wet, dry border. And mainly if your patient is old, because the mucosa is very dry, and there is no fat under the skin, and you can go across a vessel if you use a needle. So please use the most often that you can the cannula. So if we are injecting into the face, and we want to consider a lower face treatment, we can come into entry point, very interesting, located just behind the facial vein, of course behind the facial artery. This entry point could be located into the jaw. Very interesting, because if we are behind the facial vein, and on this line, on the mediojugal line, behind the facial vein, so I think 5 millimeters behind, we can have a center of gravity of the jaw, and we can very easily inject all the areas of nemiside. For example, I can come into this entry point and injecting the mid-face with boluses that I show you here, for example. I can inject with the same cannula the lower face, and you see with different boluses, very strategic. You can see the stop facial aging method that I have published in the GK journal if you want to see it. So this is interesting, because you can manage the treatment of the heavy cheek with a first treatment in the mid face, and after that you can inject the lower face. So it's very important to consider that. I don't know if you see my drawing. Yes, probably. That the face contains different facial fat compartments, superficial fat compartment. And I want just to focus on an idea, very interesting. It's that when we are injecting the face, we do with the volumation, facelift, medical facelift injection. because when we are injecting, for example, the temples, we are lifting, you know, all compartments join with the temporal fat compartment. So for example, if I inject in the temple, I will lift all this area, meaning all the same compartment. And when my patient is young, it's more effective because all ligaments and muscle are very strong, you know, fixed together. And if the patient is old, it's very hard to have a volumation and a medical lift with injection. So it's for that you have to ask your patient to go sometimes in surgery or to do threads, because if you inject old patient in order to have a lifting effect of the lower face, you can have the contrary. You can have a heavy cheek, and it's a problem. So now I would like to show you four different videos. So Anna, please, can you show us the injection of the lips? So the first patient, I show you an injection of lips. It's a young patient. It's a trend now to know, to enhance the volume of the lips. So I use 25 and 5 centimeter cannula, SoftFil cannula, of course. And you see here, I am superficial and I inject with my right hand, but I help my right hand with my left hand to take the skin and to go, easily with the cannula. So you see here a first gesture. I put a small quantity of product in order to do the anesthesia with the filler, because it contains lidocaine. I used here a Vivacy product. So you see where is the cannula, just into the mucosa. You avoid, of course, the orbicularis oris muscle. I am above the muscle and I inject, you see the contour very, very, very precisely and superficially in order to enhance the contour of the lips, the vermilion border. And I do after the upper vermilion border. And I can inject, you see, with the product, the vermilion. So you have on young patient to consider the vermilion border and the vermilion. With the 25 gauge cannula, 5 millimeter, it's 5 centimeter, it's the best cannula. So you see here the difference between before and after. Now, please, you see here the result. What is very interesting is to see that I avoid the bruise, I avoid hematomas, of course. The pain is really less important with the cannula. And you see, I do a first injection in order to introduce small lidocaine injection into the lips, and after I go to manage the lips treatment. So now the other video, please. Now, this is very interesting. Now I want just to stop here to present you and to launch the Topilaz. Topilaz is the new hyaluronidase in topic. And you will see that it's a small revolution in our field, because you know how hyaluronidase injectable is dangerous because animal, because allergic, and you know how we have to precise, sometimes the reduction. And hyaluronidase, it's very hard to have a very precise reduction of volume with the hyaluronidase injectable. And in Europe, it's forbidden to inject the hyaluronidase without, having the medical device, usually. So in France and in Europe, it's not. Now it's very hard to find a hyaluronidase injectable as a medical device. We have some hyaluronidase cosmetic injectable, and it's forbidden. So here it is very interesting because it's only a cream, a powder contains some enzymes, of course, hyaluronidase, lipase, and protease. And into the lower valve, lower compartment, we have some, essential oils. And when we mix together the enzymes and the essential oil, we have a very active solution. And when I put this solution on the lips immediately after injection, I have a reduction of volume, as you see here, but I don't lose the total volume that I have injected. And if I want to lose the whole volume that I have injected, I have to do 2 or 3 sessions. Now, next slide. We have another injection. I want to show you the sheen injection. So, of course, I use the SoftFil Precision, the 23 gauge and 3 centimeter only. Very interesting because you do a point, an entry point into the middle on the sheen symphysis area. On the pogonium, I do this introduction of a Preol needle, or sometimes easy guide if you prefer. I remove the needle, and in this entry point, I introduce the cannula perpendicularly to the bone. So probably, Anna, you can go a little bit faster. Like that. So you see the introduction of the cannula perpendicularly. With my left hand, I help the introduction of the cannula. After that, I have to move the red point down because I want to be deep, and I create a bone projection with a very high reticulate, cross-linked product. So I am on the bone and I put a bolus. Usually I use, I use half syringe when I want to create a good projection, and specifically on Asiatic patient. And after that, I move the cannula on the hypodermis. So you can see, Anna, can you please go faster? So usually I go, very superficially. After injecting the bone, I go superficially into the fat, and you see here. Now, Anna, can you go faster, please? Faster. To get, yes, you see here, I change usually the product and I keep the same cannula. I change the product and I use, low reticulate product, lower reticulation for the hypodermic layer. So here you can see it. Go faster, Anna, please. Until the end of the movie. Thank you. You see here, I am moving the cannula into the fat, and I am into the deep fat compartment. So now you can show us the result. What is interesting, it's the restoration of volume immediate with the cannula. So I did on her little bit the tear trough area, the sheen and the lips. Now, next slide, please. So here, this is how I can manage the lower face when I want to inject a patient, in order to create this medical lifting. So probably, the stop fascial aging method, but here it's exactly the same. I introduce the cannula into the mid-cheek in the entry point I showed you before, just behind the facial vein. How we can see the facial vein when we have our patient in front of us. You ask your patient to contract the mandibula, and you feel the anterior border of the masseter. And where is the anterior border of the masseter? Is coming the facial vein just in this area. So when you have to, you have located your entry point after you introduce the cannula. Here it's a 22 gauge, 7 centimeter cannula. I move the cannula on the shin. So you know what I do? I go into the fat, all along the fat, superficial fat compartment. And after I go deeper until the mid shin, and I introduce a small quantity of product. Usually for the bone layer, I use a very high cross-linked HA. So for example, it could be XXL from Vivacy, it could be volume from Restylane Volyme, it could be the deep, ultra deep from Teoxane, or the Filmed, the product from Filmed, the volume. After that, I go behind the heavy cheek. I have 2 boluses that I do, and you see here I inject the first one here, just behind this facial vein. And after another one, I am injecting now the last one here in the mandibular angle. You see, I show you with the cannula, but I come from this entry point. Very interesting, because the patient, doesn't feel pain. I am very deep. I inject on the bone, and I have proved that it's possible to do a bolus with a cannula on the bone with Patrick Trevidic, my friend, surgeon and anatomist. And now you see the difference is coming. And now, Anna, please, I will show you the difference between before and after. So you see here the difference. So it's very interesting with the stop facial aging method, because we can inject. I show you what I did on this patient. I took only, sorry, I'm coming back. So I took an entry point located, just behind the facial vein here. My only entry point each side. Here I introduced a 22 gauge cannula and 7 centimeter. This one, you see here. It's very rigid and very easy to inject in the superficial fat and in the bone in the same with the same cannula. So after that, I have injected the boluses on the mid cheek, mid face, and after into the lower face here. And after that, I combine this area, this bone level, with an injection into the deep fat with another product. So it was a XXL from Vivacy on the bone. After that, the XL into the deep fat and the L into the superficial fat. So it's very interesting because you see the global restoration of volume. Now, the other one, the other video. So here it was very interesting because I think that we have to avoid to forget the skin texture. And we can inject the skin texture with a cannula, of course. It was a product from Filmed company. I love, those products. Usually I can use the NCTF or, the fine line. It was a fine line combined with NCTF. It was a BioNutriLift, protocol. And I was injecting all over this entry point, the Filmed, the fine lines product everywhere in the subcutaneous fat with the 25 gauge and 5 centimeter cannula all around the lips in order to prevent the, the code bar, these perioral wrinkles. I inject all over the entry point on the subcutaneous fat, this skin booster. You see, the level of injection is very superficial, as we can use when we use a needle, 3 millimeter, So it's very interesting, and it's not painful and it's not traumatic. The patient can go out without trauma and without pain. So you see the distribution of volume everywhere, all around the entry point. You can see here the nasolabial fold injection. So it's like that when I manage the treatment of the nasolabial fold. I'm coming just above the nasolabial fold in the lateral external area, and I inject like that, you know, perpendicularly to the fold, because it's safer, and I don't want to inject in the same direction than the facial artery. So usually I do this fan shape, and it's very appreciated by the patient. The next slide, you see, it's finished now. So I hope that it was interesting for you. Please, Luciano, can you come back?
I'm here.
You are here.
Voice.
So
yeah, we have a question. We have a question. Thank you so much to the two of you. Now is the time for everyone to ask questions. We still have a few minutes to answer anything you might want to know. So take advantage of this time to ask everything in the Q&A section or in the chat section. A question from Dr. Saad. I fear that 2630J cannulas are as sharp as needles and may carry the same risk of intravascular injection. What is your opinion?
So if you want, I can answer something very interesting. It's, you know, I think it's a very, very short cannula. So this cannula is very round. You have to see this cannula because the tip is really round and really different than a needle. Okay, it's the caliber is fine, is thin, but the tip is really, really round. So you avoid a lot the intravascular, injection. So what do you think about that, Luciano?
No, I I agree with you, and you know, I show you the case what was injected here, you know, which is something that we use very frequent to open the nasolabial angle, okay, and with the with the 26 gauge, the short one rounded, it's more. I feel safer, and I think it's safer rather than the 27 needle. And even when we are treating, for example, when you are treating only, for example, opening the nasolabial angle and masking the convexity of the dorsum, okay, feeling the concavity, the proximal one. So also in that case, you can use it, and it is, and I think it's safer than the needle itself. So,
but yeah. I would like to add something interesting, because the recent publication conclude that the rate of injection is something very important to take in account when we are injecting. And if your rate of injection is very fast, it's a problem, because you can have more vascular compromise with this. So you need to be careful, and specifically with short cannulas or short needles, of course, because your rate will be faster.
Faster, yes. I completely agree with you.
Another question? Anna, do you have another question?
For now, no, we don't have any more questions. People are asking if it will be recorded, and yes, the webinar is being recorded, and you will find the replay on SoftFil's website, and we will also send an email with the replay. Oh, there's one more question. Is there any area where you will aspirate while using a cannula?
So for my part, I think that the aspiration is not a good thing, and we are going to back with this concept, because now we know that the variation of anatomy is really important, and we don't know really where is artery. And when you are aspirate, even if it's a needle, you can move a little bit your needle, and you are not, you think you are not in the vessel, but you are. So, and with the cannula, you can move the cannula, and it could be more dangerous to aspirate than if you don't do it. So what do you think about that, Luciano?
No, I agree with you. I mean, no aspiration with cannula, that's for sure. One thing I just wanted to when I talked about noses, I mean, we could stay, because I know Sandrine, for hours talking, and I know all our colleagues will be interested in doing lots of questions, I guess. Be very careful. Another thing I didn't put there, when you're injecting, I'm talking about the nose, which is something I've seen, the worst things I've seen there. So when you're talking about the nose, be very careful if the patient has been treated before,
yeah.
Okay, and with what filler, because this changes the flexibility of the arteries of the vessel. So in that case, it's much more risky. So be very careful. And I'm telling you, use your cannula, maybe use the power of the undermining before injecting, which is a very nice things that we can do with cannulas, okay?
And something more that you have to know, in recent publication too, it's that when you use a needle or cannula, you need to move the cannula or the needle like that, you know, in order to avoid the vessel. More you will move the cannula, and better and safer it is.
We have a question about the easy guides. When is it best to use the easy guides?
So usually, to use the easy guides, you need to, the best location are the bone. So when, for example, you want to inject the temporal area, you put your easy guide like that, okay, in the superior border of the zygomatic bone, zygomatic arc here, and you can inject like that. If you want to inject, for example, the cheekbone, you can use the same entry point, but in another direction. If you want to inject with a global concept, the face, you can do what I showed you here. You can do an injection with the easy guide, and after you can introduce the cannula. If you want to inject the shin, in the middle of the shin, here, you see the shin symphysis area, you can introduce the easy guide. For nose, I don't know if, Luciano, you use easy guide for the nose?
Yes.
Yes.
Why not?
For nose, you can on the tip, of course. Be careful to be how do you say, very, soft when you introduce the easy guide, but you can. And of course, you can introduce the easy guide in the mandibular angle, like that, if you want, and go on the bone along the horizontal branch of the mandibular, if you want.
Our next SoftFil Academy webinar is going to be focusing on the easy guides. So if you want to connect next month, you will know everything about the easy guides. We have another question. Does the red dot match the port? And what position do you advise for tear-throughs?
Okay, so usually for tear-through, you have to consider, for example, you know, for my part, it's my technique, but there is a lot of technique, and a lot of are very good. For my part, I inject, you know, usually just in the malar area, in this entry point, in order to be, you know, very lower than the zygomatic ligament. And after I inject here, I go just above not above, below the zygomatic ligament. And of course, I go through this ligament and below the ligament, and after I move the cannula like that, and I feel the orbital rim, and I inject, you see, very, very deep with this red dot down. If I put the red dot down, I'm sure to be the deeper that I can. So on the periosteum. And Luciano, what do you do?
No, I agree with you. My entry point, as I said before, because generally we can restore everything, maybe other areas, and I will go, yes, also more or less as you said before, just a little bit below the zygomatic arch, so that I can dominate. So that I can dominate the whole area. Of course, depending, of course, if we need to treat only the tear trough, or if we need to blend the zygomatic area. And this is, let's say, the power of the cannula, because with only one entry point, I mean, you prick your patient once, and this is something that those who maybe when you tell them, I will use the cannula, oh my God, no, but it will prick you only once. And I always show them, you see, it doesn't prick. I have one, of course, there. It doesn't prick. It's not a needle. This is something. And the only thing they feel, maybe, I don't know if you agree, Sandrine, is when they feel just a clack when you pass the zygomatic ligament, and it's the only thing, but it's just a perception of the click. It is not pain. It's completely painless. And you prick only once. If not, you need to prick several times, which...
And I add something, it's important to be deep in this area, of course, when we are injecting the dark circle, but what is very important is to be deep, because when you smile, when your patient will smile, you need to be below the muscle and the ligament, because like that you will have more natural results. If you are superficial, more superficial than the ligament, yes, the smile will take with him, you know, the product. So it's very, very unnatural. And of course, if you do the botulinum toxin the same day with a superficial injection on the tear trough, you can have very, very bad result, because you block, you know, the orbicularis oris muscle, and in the same time you inject superficially. So your patient will be really, really, I think, disappointed by the result if you do that. So be deep, sorry, Luciano, be very deep and red point on the basis down.
But we have, I wanted to say, but you have topilaz. Okay, so when we see patients that have this, we will use topilaz. Once they are okay, you can treat them and you go deep to the right point with your cannula, right?
You see, the position of SoftFil today, it's to be safe with cannulas and topilaz.
No, for sure. We invite them, our colleagues, to try.
Thank you so much. Do we have time for a last question? Or maybe very quickly, a last question. Biostimulation and subcision with cannula while treating the face or other areas are real benefits of the use of a cannula, as well as the safety of usage.
Exactly. This is a good, very good notion. And you know that in the US, a lot of doctors are using the cannulas only for subcision and for stimulation, no product. And why not? And they charge for this. But it's a good treatment. I just want to say something, no relation with what we were saying, but when we consider the shin, I forgot, you know, my friend, this one. We have two patients today. Look at the shin. It's, of course, it's not the same shin. So you have to do 2 boluses on the middle of the shin for man and only 1 for woman. So you need to consider, you know, the mandibular angle here a lot with the men. And of course, you need to have 2 you know, shin tubercles in the middle. I forgot to say it.
All right. Thank you so much to you, Dr. Lanfranchi, and to you, Dr. Sebban. Thank you for everyone for participating. The replay will be available tomorrow on SoftFil's website, and we will see you soon for our next webinar that is on October 27th. As I was saying, it will be focused on the easy guide. Thank you so much.
Thank you.
Thank you. Take care.
Bye.
Bye.
Bye.